Welcome to Beyond Death, a podcast that is rewriting the conversation about death, covering a range of topics in the death space, and really importantly, celebrating the wonderful people that work in this arena and hearing stories from those who are affected. I'm your host, Dr. Susie Shelmerdine, a children's imaging expert and co-founder of Anubix, a leading post-mortem imaging reporting service provider. Many of you out there will remember that on this channel, I'm usually the producer behind the scenes, producing all the episodes. But today I've launched a takeover as host because we have a very special guest visiting London all the way from Australia, no less. So I am delighted today to be joined by Dr. Padma Rao, a fellow children's imaging expert who is Director of Medical Imaging at the Royal Children's Hospital in Melbourne. Dr. Rao's career in medicine has spanned over 35 years and covered a range of different roles, including clinical, academic, educational, leadership roles, and she also has acknowledged expertise in several areas of pediatric imaging. She's very much involved in not-for-profit and charitable pursuits, assisting children obtain specialist medical care in developing countries with a focus on being skill transferred to the local healthcare personnel. However, today she's joined us on this channel to talk mostly about post-mortem imaging in children. Wow, what a lot of skills you must have, Dr. Rao. I've only briefly touched upon some of them, but would you like to tell us in your own words what it is you do?
Thank you very much, Susie, and thank you for inviting me to talk to you today. So I am a specialist pediatric radiologist. That means I specialize in imaging of babies and children. My professional title is Director of Medical Imaging. And what this essentially means is that I'm the head of the medical imaging department, which is sometimes also referred to as the radiology department. My role is multifaceted. Some of my time is spent doing clinical work, that is reporting of the different types of imaging scans, such as X-rays, ultrasound, CT, and MRI. I work in a teaching hospital, so education and supervision of trainees, both local and international, is a very important part of this role. And as a director, a large part of my role is leadership and strategic development, managing the large multidisciplinary team of around 126 staff members. I do also have a strong interest in research, and I'm currently involved in several international research collaborations. Some of these involve post-mortem imaging in children. For example, I'm a member of the European Society of Paediatric Radiology Post-mortem Imaging Task Force. The main focus of this task force is to guide and standardize non-radiographic post-mortem imaging, that is, post-mortem imaging using scans such as CTs and MRIs. As a radiologist, I'm also involved in reporting of these post-mortem studies.
Amazing. So that's quite a great roundup of everything you do, but I'm really interested in your post-mortem imaging work in children. Can you tell me a little bit about how you first got involved in this and what interested you about this work?
I certainly can. So to answer this, I'm going to delve a little bit briefly into my history. So after training as a medical doctor in London, I underwent further specialist training in general medicine and then decided on a career in radiology. I underwent further subspecialist training in pediatric radiology, that's imaging in children and babies. And I did this in one place at Alderhay Children's Hospital in Liverpool. And it was during my time at Alderhay that I was fortunate enough to be under the supervision of one of the pioneers of pediatric radiology in the UK, Professor Helen Carty. And Professor Carty was a leading authority on imaging in non-accidental injury, or child abuse as it's known. And it was here that I developed a particular interest in this area of imaging, which then developed into a broader interest in forensic and post-mortem radiology. So I've been lucky enough to be invited to collaborate in research, publish multiple journals and book chapters with individuals across the world. So forensic and post-mortem imaging isn't an area of medicine that suits everybody. It can be challenging and unsettling and emotive. But I feel that it is important to remember that through this imaging, we may be able to provide families with answers to unresolved queries they may have about the death of their child, thus providing potentially some closure to families. And in some circumstances, it can assist us in discovering potential inherited disorders. And so that's something that's really important for families to know.
Absolutely. And sometimes you pick up things that people didn't know about, which you said. So how does a child get post-mortem imaging in Australia? Can anyone just ask for it? Does it happen to all children? Who gets it and why do they get it?
And this is a very interesting question because in Australia, there are several scenarios as to why post-mortem evaluation may happen. And this also touches upon the broader coronial system in Australia. So the first scenario is when a child is unwell in hospital and unfortunately passes away. The child may have a known illness or genetic condition, or they may not yet have a diagnosis. However, the death was an expected outcome. In these sorts of situations, the hospital doctors will discuss with the family about post-mortem evaluation. This would also include a discussion about a full post-mortem autopsy examination. However, many families decline this option as they feel it is somewhat too invasive. So then discussion would then take place with the family about the alternative of post-mortem imaging as a substitute for an open autopsy due to its non-invasive nature. As I've mentioned before, from a medical perspective, the imaging may assist in finding out more about the illness or the cause of death, and potentially to help further medical research and understanding. However, in this sort of scenario, such as the hospital postmortem examination, it isn't necessarily a legal requirement. It always requires the family's permission and consent. Another scenario is when parents or guardians request for a postmortem evaluation themselves to be carried out if they feel that there is lack of knowledge and understanding of the cause of the death of their child. This, again, can be a full autopsy or postmortem imaging or a combination of both. This does have to go through the coroner, who may grant this request, or they may refuse the request for the reasons they will then discuss with the family. A third scenario is when a death has been reported to the coroner, who requests the post-mortem evaluation to occur. There are various reasons why a death is reported to the coroner, such as violent and unnatural deaths, deaths in custody, deaths in care, and this includes residential homes, deaths during or within 24 hours following a medical procedure, deaths in unknown circumstances, and also deaths that happen in suspicious circumstances. And then finally, there is a category whereby the Minister for Health can request post-mortem evaluation, which is quite a rare situation, and it arises when there is a need to identify a risk, either actual or perceived, which is there to the health of the public. Now, before this occurs, the Minister will contact the most senior next available of kin to discuss the matter.
I see. Thank you so much for laying all of that out. So there's a huge variety of different ways that this could happen. And who pays for these scans? Is it the family? Is it the coroner? Is it the system? Who would decide on that?
Well, this is an interesting question, and it is quite varied, as is overall, it depends on the state one lives in. So I could talk in detail about what happens in the state of Victoria. And essentially, there are two categories of patient. So we have the patients referred to an institute called the Victorian Institute of Forensic Medicine. We call it VIFM for short, which was established in 1985 following the 1985 Coroners Act. And this provides forensic pathology and scientific services to the state coroner and the Victorian justice system. Now, the Coroners Act of 2008 explicitly incorporated imaging into the Victorian coronial investigation, it being deemed an important component of the preliminary examination process. And imaging would include X-rays, CT, MRI, ultrasound, and photography. So all cases transferred to VIFM, V-I-F-M, are coroner's cases, and all of them will have post-mortem imaging. Now, these facilities to perform the post-mortem imaging is actually housed at VIFM itself. It's within the Forensic Institute building. And currently, all children's cases will have a full whole-body skeletal survey and a whole-body CT evaluation. But an MRI scanner is currently being instituted and installed there, and going forwards, hopefully from later this year, all of the paediatric cases referred to the coroner, and the Forensic Institute will also undergo whole body MRI. So you asked about the cost, and because these scanners are in-house at the Forensic Institute, the cost of undergoing the imaging at FISM is covered by their overall medico-legal death investigation budget, and this is funded by the Department of Justice in Victoria. There may be some additional costs for reporting of the studies that comes under the budget of the Forensic Institute, so that's slightly separate. So thinking about other states, all of the large medico-legal death investigation centres in these other states also have in-house post-mortem CT, and in those states, they're mostly funded through the Department of Health rather than the Department of Justice. But there are some smaller centres, such as the smaller states, such as the Australian Capital Territory, larger states but with less resources, such as the Northern Territory and Tasmania, that they rely on hospital resourcing, hospital CT, MRI capability. So not all of the cases are scanned. And those may be funded on a per-case basis. But for example, in Australian Capital Territory, there is only capacity to scan a certain number of post-mortem cases per week. So they are scrutinised as regards the requests, and they have to be selected carefully. Okay, so the second category are the cases in Victoria which aren't referred to the coroner, but may be scanned within the hospital. These do rely on hospital resourcing capability and are either funded through the hospital budgets or potentially not funded. They're sort of done pro bono. And the decision to scan is made by the legal guardian after discussion with the doctors. So these don't always get performed. They may not be the resourcing for this.
I see. Thanks so much for highlighting that. Just out of curiosity, how common is it to have a scan done? How many would you see a year, or would you report, for example, in VIFM?
There's on average somewhere between 1 to 2 per week. So it's really around maybe the 70 per year on average that we're doing at the present time.
Okay, thank you so much. That's really interesting. And you mentioned earlier that parents or guardians can potentially ask to have a CT, post-mortem CT done. Is that right?
That is correct. And as discussed, where this takes place depends on each state, but it also depends on the local resources and whether or not it's a coroner's case. And those are the three main factors determining this.
I see. And of the different CTs that you report every year, what are you seeing as the common reasons for children dying or the diseases that you see on these scans?
Yes, so this is again a very interesting question, and it's quite a broad answer. But just prior to answering this question, I just wanted to tell the listeners that it is important to point out that following death, there are various body tissues that undergo what's called expected post-mortem changes, which are reflected in the imaging. And some of these changes can both mimic and mask underlying pathology, which does make it quite challenging and complex to interpret the imaging. However, that said, with many of the early infant cases referred to the coroner, often no radiological abnormalities are found that point to a cause of death. We see normal expected post-mortem changes, but, for example, no additional signs of, say, trauma appear to be evident. Many of these cases are eventually classified as SUDI or SUDI, which means sudden unexpected death in an infant. Sadly, in many of these cases, the story that we obtain is that the baby was put to sleep within the same bed as either one or both parents or an older sibling, and in the morning was unfortunately found dead. And, the hazards of a baby co-sleeping with another child or adult are well established, but the message is perhaps not as widely out there as we would like. Another category that we do see is a major trauma and motor vehicle accidents, which form a good proportion of the post-mortem imaging cases, particularly if there's uncertainty as to why the accident happened. Often in these cases, the level of injury we see is sort of commensurate with the injury and the story. And unfortunately, again, I see a significant number of cases where the cause of the accident is perhaps a parent or a carer or somebody reversing their car over a child on the drive. Maybe the infant was not fully supervised, but also was not in the line of sight of the driver. Another important and quite large cohort that I see are children who have suffered physical abuse, a term that we call non-accidental injury or a suspected non-accidental injury. And in these cases, there are signs of physical trauma, maybe to the soft tissues that we can pick up on imaging, but also to the bones with fractures. And there may be also evidence of injury to the brain, which can often be very severe. And then there are the categories of children who succumb to a known underlying condition, such as a childhood cancer or a genetic or metabolic disorder where life expectancy is low. And all of these may show manifestations of their underlying conditions.
Thanks so much. That's a really thorough explanation. And it sounds like there's a variety of different things you can see, but quite a lot of it may not necessarily point to a particular disease, for example, the SUDI cases. In the UK, quite a lot of people who listen and are interested in post-mortem imaging come from religious faiths who want to try to avoid an autopsy as much as possible. Do you think that much of the imaging that we do in children can prevent an autopsy happening?
I wouldn't necessarily use the term prevent. It may assist in the cases which are not coroner's cases that would, in our state, go to autopsy. It may assist in giving answers to families without potentially the need to go to a full autopsy, or it may assist with a limited or targeted autopsy, which may be something that families feel that they would find acceptable, to give some answers to help perhaps direct our thoughts in a certain direction as to what may have occurred, as well as the imaging helping to direct our thoughts in towards a certain diagnosis. If it's normal, it may also provide answers as well to the family.
So now, having heard you speak today, there will be some radiologists out there who are listening in who might want to learn how to do post-mortem imaging and reporting as well. At the moment in the UK, we don't really have a post-mortem imaging fellowship as such or specialty training for this. But there are people who want to do it. Some may be generalists who may think, can I do pediatrics post-mortem? Some may be pediatric people, a wide variety of different sorts of people. What do you think is a good place to start?
So there have been many articles written in the radiological literature on post-mortem imaging over the last, say, 10 to 20 years. Regarding children, a search in the journal Paediatric Radiology would be a very good start. In addition, there are several good textbooks available on post-mortem imaging and forensic evaluation of death. And again, a Google search will come up with these titles. There is a new book that's expected to be released later on this year on post-mortem imaging of the fetus and child, which will be an excellent text reference for people who are involved in post-mortem imaging or would like to get involved in post-mortem imaging in children and the fetus. Within Australia, and the Royal College of Pathologists of Australia have taken it one step further, and I am involved with them. I do have a fellowship allegiance with the College of Pathologists of Australia, and we are at the moment developing a fellowship in post-mortem imaging, which will be accessible to both pathologists and radiologists.
That's amazing. And can anyone apply to that, or is that specifically for Australians? Is it virtual or in person? What will that entail?
So some of that detail is still to be determined. There will be certain requirements for the pathologists as to what the entry requirements are, and there will also be certain requirements for the radiologists. We're still in the early days of working all of this out, but hopefully within the next 12 to 18 months, we will be able to roll this out.
That's really exciting. And I'm sure many listeners who are fascinated and interested in this will be keeping an ear and eye out for that to come. So we've covered quite a lot today, and we're coming now to our very last question of the interview. We have a tradition on this show where we ask all of our guests the same final question. And that question is, what is the biggest misconception you think people have about you or your work or both?
Thank you. It's a question that made me smile when I just as you are asking this to me. The radiologist is a doctor who remains largely unseen. The technicians perform the imaging for many modalities, and these are the people that families or parents may see. But as a radiologist, we're often behind a closed door in a dark room carrying out reporting. So what I've found is quite often people don't actually have a grasp of what it is a radiologist actually does and where they fit into the reporting / post-mortem imaging space. Certainly, the roles between radiologist and radiographer are often mixed up, and we work very closely with our fantastic radiographers who are very, very skilled, and some of our roles have similarities in some aspects of work where we come together, but we do have different training and different position descriptions. And I think one of the main reasons that there may be a lack of awareness about what we do is that overall so far, there's still maybe a general lack of awareness that postmortem imaging exists, what it can do, and how it can be helpful. And going forwards, this is certainly something that I'd like to see being opened up to more people becoming aware of this, more families, more clinicians and doctors in the broader community, so that they can become empowered to have those discussions with families.
Thank you so much. And today, this interview, I hope, has gone some way to improving that understanding and awareness of postmortem imaging. So that wraps up another episode of Beyond Death. Thank you so much, Dr. Rao, for joining us and sharing your insights. We've discussed how children in Australia undergo postmortem imaging, what that entails, what circumstances they get referred, who pays for this. And we've talked about some of the positives and negatives of postmortem imaging as well, and also the insights into training. So thanks again for your time here. And that concludes our discussion for today. But just remember, it's not the end of the conversation, because there is always more beyond death.